What were the primary results from the Partners A trial?
The primary results from the Partners A trial, which was a comparison of surgical aortic valve replacement compared to transcatheter aortic valve replacement, was a non-inferiority study that demonstrated that mortality at 1 year was similar between those patients who received transcatheter aortic valve replacement compared to surgical aortic valve replacement. And these were patients considered operable candidates.
What were the other findings presented today from this study?
Well, I think the first finding is the baseline characteristics that these patients are fairly representative of severe aortic stenosis patients that we see routinely in the clinic. These patients were in their 80s, they had several comorbidities and New York Heart Association class 3 or 4 in the vast majority of patients. And really, you're looking at a comparison between the trade-offs of surgery versus the trade-offs of a transcatheter aortic valve replacement. You save 2 days in hospital, 2 median days in hospital with ICU stay, and 2 hours of less procedure time if you had a transcatheter approach. And as well, the complications of surgery, which we expect would be higher in the surgical group, atrial fibrillation, as well as bleeding, were less in the transcatheter group. That said, the transcatheter group had increased risks in 2 specific areas. One, it was a near doubling of the risk of stroke in those patients from a 2.5% to 5% risk, and as well, major vascular complications was about 10% in those patients. And you really have to ask yourself if your patients are willing to take that trade-off.
What issues should readers pay attention to when interpreting these data?
That's an excellent question. As a non-inferiority study, the Partners A trial at 1 year is most likely going to show what they did demonstrate, which is that mortality benefits are similar between operable patients who had aortic valve replacement and transcatheter aortic valve replacement patients. Had they looked at that data at 90 days, the data would have favored the transcatheter approach. The real question is durability. How well does this technology stand up over time at 5 years and more importantly 10 years? And are these patients at that time demonstrating similar outcomes? If that were the case, I think that would significantly change the course of practice.